I'm Dr. Vincent Simonetti. I'm a cardiac surgeon from the University of Michigan. I'm the co-medical director of the Allegiance Health Cardiac Surgery Program here in Jackson, Michigan. So I was recruited by the University of Michigan and hired by the University of Michigan to be a cardiac surgeon here at Allegiance Health in Jackson. In doing so, I've committed full-time to the community in Jackson. I work full-time in Jackson. I live in Jackson. My kids go to school in Jackson. My wife volunteers and participates aggressively in the community, and we are dedicated to improving not only the overall health of the community, but the community in general.
My name is Mahender Macha. I'm a cardiac surgeon here at Allegiance Hospital. I'm the co-director of the program along with Dr. Simonetti. As far as my personal experience, I'm very proud to be here in Michigan and help start up a new program right here in Jackson. I grew up in Michigan and I went to undergrad and med school at the University of Michigan, and I had the benefit of training at major medical centers throughout the country, both in the West Coast at Stanford University, as well as my first position was on the East Coast at Temple University in Philadelphia. And having worked at multiple major medical centers, I have that depth of experience to bring back here to Jackson. And it's really been a great experience for me to bring my experience and knowledge to help build this new program and make it a successful open heart experience for the patients.
So to me personally, I think that Dr. Macha and myself bring to Jackson, Michigan, along with our entire caregiving team, a level of quality of open heart surgery that you're not going to find anywhere else. I think that we perform as well, if not better, than the majority of major open heart surgery centers. And it's in a location close to home where you don't have to travel far. And it's with conveniences that you're not going to find at many other places. So at Allegiance Health, since 2008, we've performed over 585 open heart surgeries.
We perform the most common open heart operations. These include coronary artery bypass operation, aortic and mitral valve surgery, both repair and replacement, as well as aortic replacement, aortic aneurysm surgery. So we provide the most common surgical procedures.
The Allegiance Health open heart surgery program, like all the programs in the state of Michigan, follow data quality measures very closely, which is led by the Society of Thoracic Surgeons, which is a national society, and the local Michigan Society, which is the Michigan State Society of Thoracic and Cardiovascular Surgeons. And here at Allegiance, we're very good at achieving or beating the majority of these quality measures. I think in particular what we excel at is our length of stay, meaning the time the patient stays in the hospital after their surgery is at least 1 day shorter than the average of most of the other programs, which means that they're well enough to go home in a shorter period of time. Furthermore, our readmission rate, which means that the amount of times the patients come back to the hospital after they've gone home, has been progressively shorter than the average of these other programs as well.
Yeah, the unique aspects of our open heart program are in particular the Cub unit, which is a beautiful unit. It's a new unit, and it uses this concept of a universal bed. So the patient actually gets admitted before the surgery and meets the nurse and has the same nurse during their recovery, and often in the several days following surgery. So they get to know the whole care team, including the nurses, the doctors, the PAs, and they see the same people every day. It's in contrast to other centers where they'll come in and they'll be in one unit for a couple of days, they'll go to a step-down unit for a couple more days, and then they'll go to, a floor unit for a few more days. Here, all of their care is coordinated.
It allows their family members to stay with them from start to finish in the same room. and it's a very comfortable healing environment that we have.
So the Allegiance Health Open Heart Program is unique in that we have a very high degree of involvement of the physicians and the PAs and nurse practitioners and physician extenders. There's a unique level of personalized care that is not often seen after open heart surgery.
With that, we have a tremendous amount of involvement in the care of our patients at the bedside. We will both see patients several times per day. We don't relegate it to other services.
We really have developed an excellent team here. So I think that's really what a lot of patients take away from their experience, that it's a different level of personalized care that they don't routinely get in a open heart surgery experience.
And I think proof of that is that our patients really develop a bond with many of our caregivers and come back while they're healthy to visit with us and attend reunions.
Our patients frequently come back to the office months, years later and bring us gifts and food, and we do tend to have a long-term relationship with many of our patients, yes. So regarding the quality of care here at Allegiance, I'm very proud to say that we are right at the top of the state as far as our complication rates, our length of stay, our readmission rates are really superb, and it's quite surprising for a relatively new program to have such excellent numbers. When we go to the state meetings and present our data, all of the other programs take notice and say, wow, Allegiance is really superb in terms of the quality of care that's delivered here. So we are gaining a reputation very quickly for our excellent quality of care. Mm-hmm.